Hi everyone, my name is Kayla Satterwhite and my research looked at the effect of a speech generating device on emerging vocalization in a child with autism spectrum disorder. To start off, I'm going to give a quick summary of what an SGD is. Often people with autism spectrum disorder, or ASD, learn to communicate with others using a form of an augmentative and alternative communication device, an AAC device, called a speech generating device, which is often referred to as an SGD. An SGD is an electronic AAC that uses touch-to-voice technology to present icons that produce a corresponding synthesized speech output. What this means is that I could press icons on my SGD, such as I won't recess, and each time I press the icons, I will hear I won't recess back aloud to me. SGDs are often used with individuals with severe speech impairments or cognitive deficits. Past research has been done to look at the effect of SGDs on independent communication. Lukey assessed the effectiveness of SGDs on communication and language in children with apraxia. Lukey's research was completed over the period of 1 year with one participant with severe childhood apraxia of speech. There was an A-B follow-up design used. In phase A, the participant communicated with researcher during downtime play by using gestures to communicate needs and wants. During phase B, the participant used an SGD. Phase B was split up into B1, where the participant used a fixed display SGD, and phase B2, where the participant used a dynamic display SGD to communicate needs and wants with researchers during downtime play. During the follow-up stage, which lasted approximately 3 months, the SGD was given to the participant to use to communicate, but it was not required. The results show that over the course of follow-up, the participant started using the SGD, and then as follow-up progressed over the course of 3 months, the participant stopped using the SGD and independently vocalized needs and wants. The results from Lukey's studies showed that independent vocalizations increased with the use of an SGD. Tasson and Kurt examined the effectiveness of an iPad-based SGD and intervention package in teaching multi-step requesting to children with autism spectrum disorder. The goal of the research was to examine the effectiveness of a multi-step SGD on individual communication. The 3 participants in this study were males diagnosed with autism spectrum disorder. Prior to starting the study, each participant was given a preference assessment to determine highly preferred and non-preferred stimuli. The participant used an SGD software called Dokun Konuş, which is a Turkish SGD software. This study, done by Tasson and Kurt, was divided into baseline, intervention, and generalization phases. During the baseline phase, the participant was presented 2 trays, one with a highly preferred stimulus and another with non-preferred stimulus, and then presented the iPad Air 2 with the SGD software open. The participant was asked, "What do you want?" If no response occurred within 30 seconds, the participant was given the highly preferred item, but the goal was for the participant to have an incorrect chain of response, which was opening up the SGD software, touching the icon, and then independently vocalizing to the researcher what the desired item was. During intervention, the same protocol was implemented, with the 2 trays being presented and the iPad being presented in front of the participant as well. Once the participant was asked, "What do you want?" the participant was taught during intervention through a total task chaining method to learn correct responses for using the SGD. The correct responses were, once again, touching the software, touching the icon, and then independently vocalizing to the researcher what the participant needed or wanted. The first 2 sessions of intervention were done with a 0-second time delay, where the participant was physically prompted immediately hand over hand to touch the correct icons once the participant was asked, "What do you want?" After those first 2 trials, the participant was given a 5-second time delay, where the participant was given 5 seconds to independently respond. If the participant did not respond, the participant was still hand over hand physically prompted, but if the participant did respond, the researcher mimicked and shadowed the participant's movements to ensure the participant was touching the correct icons. During the generalization phase, the participant had the same setup as baseline, and if the participant did not respond, the trial was terminated. The results from Tasson and Kurt's study showed that independent vocalization and communication increased with the use of the SGD software. Ahmadi and colleagues assessed the effectiveness of SGD on communication. The participants for Ahmadi's study were 2 males diagnosed with autism spectrum disorder. Prior to beginning the study, the participants were given a preference assessment to determine the top 3 edible stimuli and the top 3 tangible stimuli that were highly preferred for each participant. This study was broken up into baseline 1 and 2 and intervention 1 and 2. Baseline 1 was done by trays being presented, one with edible and one with tangible items, and the participant was presented the iPad. The participant was asked, "What do you want?" And if the participant did not respond within 30 seconds, the participant was given one of the items, either edible or tangible. During intervention 1, the main focus was to teach the participant how to correctly respond with the SGD software used, which was Proloquo to Go. The participant was physically prompted after being asked, "What do you want?" The participant was given 10 seconds to respond, and if no response occurred, the physical prompts continued. During baseline 2 and intervention 2, the main goal was to teach the participant how to turn on the iPad. It was a similar protocol as baseline 1 and intervention 1, except the first step was opening up the iPad and then touching the icons and independently vocalizing what it was the participant wanted or needed. During the follow-up phase, it was the same setup as baseline 1, where the participant needed to open up the Proloquo to Go software and independently touch the icons and produce the speech output of what the participant wanted or needed. Results from this study show that independent vocalizations and communications increased with the use of an SGD software. So the purpose of the present study was to examine the effectiveness of an SGD, Proloquo to Go, in emerging vocalization in a child with autism spectrum disorder. The hypothesis of the present study was that independent vocalizations in both the playground and the sensory room would increase with the aid of an SGD software, Proloquo to Go. Independent vocalizations was operationally defined as an intelligible vocalized sentence in the correct pronoun-verb form, such as "I want ball." The participant was a preschool-aged male with autism spectrum disorder. The participant had prior experience using the SGD software Proloquo to Go. Participation was voluntary and confidential, and the participant was treated in accordance with the ethical principles of psychologists and code of conduct, and the participant was not compensated. The materials needed for the study were the iPad or tablet device for the study, and iPad was used, Proloquo to Go software, which is the SGD software being examined, a vocalization data sheet to collect data, a laptop or computer to store data, and Microsoft Word to format a data sheet. As far as the procedure, the participant was first recruited from the Meredith Autism Program, also known as MAP. The participant's parents signed a consent form. The researchers set up 2 folders prior to beginning the study, one with a sensory room and all options in the sensory room to be played with, and one with the playground and all options on the playground that were available to the participant. The participant was observed in both settings, the playground and the sensory room at MAP, over a period of 8 weeks. The participant was observed for 10 minutes in each setting each day. During baseline, which was weeks 1 and 2, a timer was set for 10 minutes prior to entering each setting, and as soon as the participant entered the setting, the researcher blocked the participant from going to the desired item and asked the participant, "What do you want?" During baseline, if no response was given within 3 to 5 seconds, the participant was granted access to the item, and the researcher labeled the item for the participant, such as if the participant ran to the slide on the playground, the researcher would say, "This is the slide. I can see you want the slide." This was done so that labeling the objects was done for the participant, and the participant could learn the item names if the participant was unaware of what each item was called. Independent correct responses during baseline were defined as a correct vocalized label of the desired item by the participant, such as slide, ball, swing, etc. The participant was not given access to the SGD during baseline. Intervention lasted throughout weeks 3 through week 6, and once again, a timer was set in a similar manner, and the participant was blocked in a similar manner as baseline, and the participant was asked, "What do you want?" But this time, after being asked, "What do you want?" the participant was presented an iPad with the Proloquo to Go software open on either the playground or sensory room folder, depending on what location. The participant was to touch the correct icons to make a sentence for the desired item, touch the sentence strip at the top of the software, and then vocalize the sentence that was produced after hearing it read aloud. This means that if the participant wanted a slide, the participant was to touch the icons, I want slide, touch the sentence strip to hear I want slide, read aloud, and then vocalize independently, I want slide. This way, the participant was touching the icons, hearing the sentence, and then verbally, independently vocalizing what the desired item was. If no response occurred within 3 to 5 seconds, the participant was prompted to use the SGD using least and most intrusive prompting, starting with a gestural prompt of kind of hovering over the icon, a model prompt of the researcher touching the icon, a verbal prompt of touch this one, or a physical prompt of hand over hand, holding the participant's hand and having the participant touch the icon. The participant was not granted access to the desired item until all steps were completed, with or without prompts. For data purposes, a correct response was defined as the participant completing all steps of the desired response and vocalizing the desired sentence with or without prompts. The participant was reinforced after responses with verbal praise and tickles. Follow-up occurred during weeks 7 and 8, and once again, a timer was set in a similar manner as previous phases, and the researcher blocked the participant from going to a desired item. Once entering, the researcher asked the participant, what do you want? The participant was expected to independently voice the desired item without the use of an SGD. If no response occurred within 3 to 5 seconds, the researcher once again asked the participant, what do you want? If no response was recorded the second time, the researcher prompted the participant verbally, such as or say I want slide. It was either a partial of say I or say I want, or a full verbal prompt of say I want slide in order for the participant to be prompted. An independent correct response was determined to be when the participant independently vocalized an I want desired item sentence without the use of prompting. The participant was granted access to the desired item once the participant completed all the response steps with or without prompts. The participant was reinforced after all responses with verbal praise and once again a variety of tickles. So here are the results by week. As we can see, we'll start with the playground. The mean number of independent vocalizations increases from week 1 to 2 to 3. It also actually decreases from week 1 to 2, but then during the intervention phase, weeks 3, 4, 5, and 6, we see the numbers pretty much go up. And by week 7, we have a mean of 4 as opposed to a mean of 1.25 during week 1. You probably noticed that week 8 is not in this graph, and I will talk about that more in the discussion because week 8 was omitted. In the sensory room, we can also see that the mean started at 1.2, and it goes up as the weeks continue. During the intervention phase from weeks 3 through week 6, we see independent communication a lot higher than it was during the baseline phase. And finally, during the generalization phase, we see that there was an average of independent vocalization of 4, which is much higher than week 1. This is a table of the results by phase. So this is an average of each phase. So for baseline, the average mean of independent communications verbally was 1, and then it increased to 4.25 during the intervention, and a follow-up, it was at 4, which is much higher than baseline, which was at 1. For the sensory room, we started at 0.8, and then we increased to 3.64, and then we once again increased during follow-up to 4 independent communications and independent vocalizations by the participant, which is much higher than it was during the baseline. Here's a graph of results to compare the playground and the sensory room. As you can also see on the graphs, there are more days for the sensory room, the playground, which I will also discuss the reason for this in the discussion. So for the playground, we can see that the number of vocalizations during the generalization phase was much higher than the number overall vocalizations during the baseline phase. And for sensory room, we also see the number is much higher for generalization than it was for baseline. So the purpose of the present study was to examine the effectiveness of an SGD, prologue to go, in emerging vocalization in a child with autism spectrum disorder. The present study supported Lukey, which concluded that independent vocalization increased with the use of an SGD, which is also what the present study found. The present study supported Jink, Tassan, and Kurt, which concluded that independent vocalization also increased with the use of an SGD software, which is also what the present study found from the results that I just discussed. The present study partially supported Ekmati and colleagues because Ekmati and colleagues results show that independent communication increased with the use of an SGD, but they also went a step further and concluded that the SGD software was not efficient when the iPad was locked and the researcher had to get into the iPad. The present study did not look at how the participant did with a locked iPad, but the present study did conclude that independent vocalizations increased with the use of an SGD. So limitations to the study are inclement weather, the SGD software used, and the sample size. A lot of days, as I discussed, on the playground did not have as many days as a sensory room because of inclement weather, whether it be snow or rain. Obviously, we cannot go outside in the rain or the snow, so some days of the playground were omitted, and essentially week 8 was omitted because of inclement weather, and the participant was not able to go on the playground at all during week 8, so week 8 was omitted because I did want to have a whole week more, so 5 more days of the participant being in the sensory room but not the playground. Another limitation was the SGD software. The only software used was Proloquo to Go. We didn't use more than one software, so even though the study found that independent vocalizations increased with the use of an SGD, only one SGD was looked at. Finally, the sample size is a limitation because we have a sample size of 1, and we can't generalize the study to the population as a whole because our sample size is only 1. So for future research, we should first establish an inclement weather plan, whether it be not doing sensory room at all when playground is not available, or having alternative assignments or an alternative environment inside similar to the playground. We should also have a larger, more diverse sample size with a greater variety of SGD software. With a larger, more diverse sample size, we'll be able to generalize our findings, and with a greater variety of SGD software, we can also generalize our finding over many different forms of SGD softwares, or we can even compare which one works best for one participant, or look at the participant's want or desire to use a specific software. In conclusion, the data and results can be used with children with autism spectrum disorder and families within the home and school and everyday life. The results can be used to increase quality of life and aid children with emerging and vocalization in communication with others. Thank you for listening to my presentation and watching. If you have any questions, I would love to answer them or talk to you about my research. My email is knsatterwhite@email.meredith.edu, and you can contact me there. Thank you.